National Population Strategy 2021-2030. Enabling, delivering, empowering to achieve well-being. In line with our vision for a state of health, social and economic well-being enjoyed by the entire population.
The National Population Strategy for 2021-2030 came into existence, developed by the Higher Population Council in partnership with all governmental and non-governmental agencies, civil society organizations, the private sector international organizations. With the support of UNFPA, the strategy aimed to identify population-related issues in Jordan as key national priorities.
The Hashemite Kingdom of Jordan has adopted the basic elements of population policies that guarantee the right to a decent living standard for the population. Many measures have been taken to achieve comprehensive development, reflecting Jordan's international commitments with respect to population issues.
Despite all the accomplishments that have been made, achieving population-related goals in Jordan is still faced by challenges, namely high poverty rates, high unemployment rates, the gap between population growth rates and economic growth rates, limited participation of women in the economy, mismatch between education system outcomes and labor market needs, inequitable distribution of development gains across governorates and regions, scarcity of water resources in Jordan and its impact on food security, and recently, consequences of COVID-19 and short and long-term emergencies. The challenges of making comprehensive SRH information and services accessible, gender-based violence, high population growth rates in major cities and the resulting strain on services, economic underperformance, the refugee crisis, demographic, social and economic changes in the population structure over the past 2 decades, and future population estimates all call for revisiting population-related priorities.
In response to that, the National Population Strategy for 2021-2030 was formulated. The strategy consists of 4 key pillars: the socio-economic and social protection pillar, women and youth, health and reproductive sexual health, migration, refugees and crisis.
The first strategic objective: achieving economic and social well-being through implementing responsive interventions to reduce poverty, reduce unemployment, achieve food and environmental security, improve the quality and outcomes of education, provide social protection especially for the most vulnerable groups, achieve sustainable urban growth, achieve economic growth, and end gender-based violence.
The second strategic objective: empowering women and youth. This includes the sub-goals of building the knowledge capacities of young people and those working with them, strengthening positive social norms, attitudes and roles, ensuring that women and girls enjoy a life free of all forms of gender-based violence, ensuring that women and girls can access the right to participate and lead freely in a society free of discrimination, fostering an environment for youth work to support creativity, innovation and entrepreneurship, to promote social entrepreneurship and address challenges in unconventional ways.
The third strategic objective is related to health and sexual and reproductive health, achieving universal health coverage and universal health insurance, ensuring access to SRH information and services, promoting healthy lifestyles, and raising awareness about the handling of health emergencies.
The fourth strategic objective is about capitalizing on migration, asylum, and crisis management. It includes several sub-goals: enhancing self-reliance and the living conditions of Syrian refugees and vulnerable Jordanians, fulfilling humanitarian needs, ensuring equitable distribution of development gains, limiting internal migration, reducing environmental and natural risks, limiting external migration and brain drain, and addressing population-related priorities at times of emergencies and pandemics.
To ensure the effective implementation of the strategy and the achievement and the desired goals, a monitoring and evaluation process is put in place, including a strategy matrix identifying KPI baseline and target values, KPI data collection, and annual monitoring and evaluation reports.
Through consolidated efforts, we can achieve a state of social, economic, and health well-being for Jordan and the entire population.